On 30th of March at 4 p.m. CET, HealthManagement.org brings together some prominent healthcare experts at the Novelty versus Legacy DigiConf to discuss the challenges of introducing innovation, technological, clinical, management in healthcare practice. Click the link in the description to secure one of the last available places. Immunity to the coronavirus doesn't magically manifest the day you get the Covid-19 vaccination. According to the CDC, you are not considered fully vaccinated until at least 2 weeks after the dose in a vaccine regimen. Thus, vaccinees are cautioned to carefully change their behaviour and not expose themselves to the virus before the protective effects of the vaccine kick in. European countries are all set to restart their rollout of the AstraZeneca COVID-19 vaccine after Europe's medicines regulator concluded that it was both safe and effective. 13 countries in Europe had suspended the use of the AstraZeneca vaccine over fears of a link to blood clots. However, the vaccine has not been found to be associated with a higher risk of clots. Germany, France, Italy and Spain will resume their use, while other EU states are in the process of deciding when to restart. Mary Ramsey, a leading epidemiologist and the head of immunisation at Public Health England, predicts that people may need to wear face coverings and socially distance for several years until things can go back to normal. She says that until other parts of the world are vaccinated and the numbers come down everywhere, we cannot relax. Other scientific advisors have also said that maintaining a baseline of policies to reduce transmission will be necessary for some time to come. New findings show that females with high body fat and high muscle mass had a 42% lower risk of dying from cardiovascular disease than females with low muscle mass and low body fat. By contrast, males with high muscle mass and high body fat had a 26% lower risk of dying from CVD than males who had low muscle mass and low body fat. Males with high muscle mass and low body fat had a 6% reduced risk. Read in the new issue of HealthManagement.org, the journal. Dr. Ton Hanselaar and Mathix van der Linde discuss issues and success factors related to the implementation of value-based healthcare. Dr. Raphael Grossman talks about the challenges of disruption in healthcare and the prospects of embracing inevitable progress. Professor Geraldine McGinty discusses the need to create a more diverse and equitable workforce in healthcare for a more inclusive future. And Hans-Erik Henriksson highlights the need to build on digitalization and innovation progress for long-term benefits. These and more exclusive stories in the latest issue, Novelty versus Legacy. Download now.